everyone. This is Gina Donahue with Elevate the Conversation podcast. I have with me today Dr. Shannon from Wellspring Dental, and she is a functional dentist. So today we're going to talk about the difference between functional dentistry and conventional dentistry. We'll have Dr. Shannon explain a little bit about herself, why she got into functional dentistry. We'll talk about the differences in approach to healthcare. We'll talk about some common issues or conditions that we both see. And then we'll give you some tips at the end about how to maintain good oral health, and especially with the holidays coming up. So Dr. Shannon, please tell us a little bit about yourself and how you got into functional dentistry.
Well, I'm Dr. Shannon Thorsteinson, and I'm the owner of Wellspring Dental. And I've been a dentist for 10 years, but the last few years I have shifted my focus to a more functional approach. And that mainly stemmed from my mother having a dental infection that we were having difficulty managing. She was having ear problems, and the ear doctor found no cause. And we ended up finding an infection with a root canal that we retreated, but it was still persistent. And so when it came time to decide to remove the tooth, I wanted to make sure that we were really doing everything we could to clear this infection because it had been there for a while. And so I sought out someone who was doing additional measures like ozone and platelet-rich fibrin after removing a tooth. And then it really felt like if I was going to all this effort and really wanted additional measures and that level of care from my mother, that I should be offering those same things to all my patients. And so that was the beginning of a shift in mindset for me and the beginning of years of study, finding that there are many people who practice that way, and there's a whole world out there with additional information that of course uses conventional dentistry as the foundation, and then adding tools to the toolbox for how to treat dental issues. So functional dentistry is something where we try to address root causes when we're treating dental issues, and we want to collaborate with other practitioners, and we want to be really treating in depth the mouth-body connection. We want to understand how what we do affects the rest of the body and vice versa. And that makes things really exciting for me. I really enjoy looking into all those things, and really the foundations that we can influence in functional dentistry are going to be gut health, inflammation, and airway health, meaning breathing and sleeping. So it's much more than just kind of teeth. Of course, we do all the teeth things, but then we, again, take that bigger picture view as well.
So one of the things that does often come up for me when I'm visiting with patients is fluoride.
Yeah.
And so whether or not it's important to use a fluoridated toothpaste, and I know I haven't used a fluoridated toothpaste ever since I got into my functional training. So I didn't realize the negative health consequences that fluoride can have on the body as a whole. I have always had filtered water, and I've always understood the need for filtering your water, although fluoride can be a difficult thing to remove from your water. You have to have a special water filter. But can you talk a little bit or address from your perspective the pros and cons of fluoride use, and do you promote fluoridated toothpaste?
Yeah, so fluoride is definitely a controversial conversation within the dental community. And we're taught in school that it's like a vitamin. There are many studies that show that it reduces tooth decay, and of course that's a primary concern for dentists. But when you have a functional approach, you also want to weigh those benefits against any negative systemic effects. So there are studies that link fluoride to cognitive delays and decreased IQ levels in children. It's a known neuroendocrine disruptor, and it can calcify the pineal gland. So there's a lot of negative effects and additional ones I'm sure that you're concerned about. So we want to think about, well, is that going to be the best approach for each patient? And for some patients, that may be a choice that they want to make. But in my practice, we don't use fluoride for cavity prevention. We want to focus on some other methods. So we do have other choices. We can look at hydroxyapatite toothpastes. We can look at studying the pH. When patients are coming in, we should understand what the oral pH is. And we want to look at diet and nutrition, and the timing of when we eat our foods. We can treat with ozone and iodine as well. So there's a lot of other options besides fluoride, but it's something that we want to take an individualized approach. We want to make sure patients have informed consent with whatever choices they're making, because there are studies that show benefits of fluoride topically as far as reducing cavities, and we want to make sure that we're reducing cavity risk. But my approach is, let's look at that more holistically, and let's look at why are we getting those cavities in the first place. Are we having issues with mouth breathing where we're drying out the oral mucosa? Are we eating something that's not promoting good dental care? Those are the bigger picture questions where we're really going to kind of move the needle more on oral health rather than just placing topical fluoride.
Mm-hmm. And when it comes to the dosing issues, so obviously I tell people to drink a lot of water.
Yes.
So adults and children should be drinking a lot of water.
Yes.
I ask people not to drink water out of plastic water bottles. Don't buy the plastic water bottles. Don't buy, the big cases from Costco, and which a lot of people do like to do because they don't want to drink tap water. So we're always having a conversation about getting water filters and drinking plenty of water. But when you talk about infant formula and tap water and dosing of fluoride, can you go into that a little bit more?
So it's tricky. So of course, topical fluoride is something that we would do in the office, right. But when we originally had the major public health efforts around the studies that were done on fluoride, that was a long time ago when there weren't as many fluoride sources. So now fluoride is in almost everything. It is in our water supply, and also most dental products have it. And so we want to be mindful about what is our overall exposure. And each person individually is at different risk levels, and we have to manage our overall toxic burden as well. So, for example, with babies, we don't put formula in tap water because then we would be overdosing them with fluoride. Right. So that's why we have to use a separate water source for that. And that's what's tough about having water in the fluoride in the water supply, is that you would get the same dose as a child if you drank the same amount of water in a day, but you are different sized people. So we wouldn't give medications in that way. We wouldn't give a medication the same dose to an adult as a child. So that's what's tough about having it in the water supplies. We can't dial in that dosage, even if we did want to use it. So, and unfortunately, the only way to filter it out is with a reverse osmosis system. Berkeley is a great home system that you can use for that. Our office is going to great efforts to filter out fluoride in our at Wellspring Dental. But it is something that everyone will make. We want to make sure we have a clean water source for everybody. Those plastic bottles. The other concern, of course, is BPA.
Yeah.
And so, of course, we want to look at glass or metal containers for water.
Stainless steel specifically, though, not
yes,
aluminum.
Yes.
Right. Yeah.
And with that, that's the other conversation in dentistry too, is we have a lot of exposure to BPA, and people who are concerned about that may also want to have a functional approach to dentistry because there are filling materials that have BPA in them, and there's actually very few that don't. So a functional dentist is going to make those kind of choices to look at and choose those BPA-free products. And more importantly, have an individualized approach where we're understanding which materials are going to be least reactive for your body. So just because it's BPA free, it may not be the best material for you. So we want to do some testing and biocompatibility testing to understand what's right for the individual.
Right. So I really appreciate hearing you talk about the toxic burden, that you're aware of it not only from dental products, but also from life. We do live in a toxic world, and we have a detoxification system in our body because the world is just naturally filled with toxins. Right. So then you add the layers of toxins that man makes, and so we do get a little bit overburdened. And we have to be mindful that it's important to take a mindful approach to eliminate known toxic sources with whatever means you have in your control, recognizing that you're never going to not get exposed to toxins.
Absolutely.
And so I recommend people do detoxes at least annually, if not twice a year. I do detox more regularly. I use a detox shake multiple times a week because life is dirty. And even though I choose to live a pretty clean life, I still recognize that I breathe the air of Georgia. I only live not very far from busy roads.
Right.
And so we're always breathing in those car fumes here.
Yes.
So again, you only have so much control over that. But I really appreciate your understanding of that and recognizing that we have a whole body that teeth are in. Right? A mouth is attached to a body.
Yes.
And so that's why my tagline is, healing the whole person, because people often come in and they want to focus on their thyroid.
Right.
And it's like, but your thyroid is in your body. And so we have to understand your whole body in order to understand how it's affecting your thyroid.
Yeah.
Right. So what are some of the common issues or conditions that you see where you wonder how the whole body is affecting the mouth? So let's kind of start out in, and then I'd like to talk about some oral issues that I see where I think in, out. Maybe?
So one of the big things that I really love to study and practice is the Bale-Donine method. And that's a method that was developed to prevent cardiovascular events and address all of the various root causes that can cause inflammation in the arteries that lead to these unexpected cardiac events, right? And so one of the big passions that I have is, like you said, whatever known toxic burden or whatever known preventive measures we can take, let's go ahead and take those, knowing that there are things we can't control. But patients we're going to treat differently based on their genetic history, based on their symptoms, based on their goals. And so with the Bale-Donine method, we want to focus on inflammation specifically, and the mouth being one of those major sources that can get ignored. So one of my questions for you is, when we're looking at cavity risk and gut health, for me, we have our influence over gut health is a discussion about nutrition mainly, and making sure that oral mucosa is healthy. But when I'm recognizing that there is gut dysbiosis in a patient and I want to make a referral and have them see a functional provider, what kind of things can you help with, and how are you going to approach that when we have concerns around gut health?
I love that question. So for me, when I'm doing an assessment on patients, I always have them, I look in their mouth, I make them smile, I have them stick their tongue all the way out. I'm always looking for scalloping on the edges of the tongue.
That's great.
Because that demonstrates the mouth is the beginning of the digestive system.
Right.
The saliva starts breaking down your food, and you've got your oral microbiome, right? And so when you see scalloping on the edge of the tongue, it indicates that there is inflammation in the gut that's significant enough to even make the tongue swollen, right?
Can we dive into that? Because one of the big things that we think when we see a scalloped tongue is a lack of tongue space, because those scallops come from the pressing on the teeth.
They do.
And so we think, okay, the jaws are too narrow when we see scalloped tongue. But I know there's more to it, and that can be related to, I believe, other conditions. So what do you think when you see a scalloped tongue?
I think gut inflammation, because the tongue should fit in the mouth. And even if it doesn't fit in the mouth, it shouldn't be edematous. So to me, I think, so that means swollen.
You
So
think swollen tongue,
edematous
yeah.
means swollen.
Yep.
It means just like you get swollen ankles, you get swollen fingers, your rings get tight. So whether or not your tongue fits in your mouth, how do I say this? So even if your mouth is a little bit too small for your tongue, you wouldn't expect to see scalloping because, again, that indicates that the tongue is swollen. So it's like if I'm checking for edema, I'm going to push my finger and see if there's a little dent.
It wouldn't stay that way.
It wouldn't stay that way. So the tongue should not have scallops on the edges. And I'm also looking, for me, I look for enlarged papilla, the redness of the tongue, for B12 deficiencies, which oftentimes, we're taught beefy red tongue. Like in school, you're expecting to see this bright red tongue yelling at you that I'm B12 deficient, but actually can be a little bit more subtle than that. Just really noticing some prominently raised papilla that are bright red. To me, that's often an indication. And sometimes you see that white coating on the tongue, which then again makes me think a little bit about candida. Or just dysbiosis in general. So when I'm concerned about the gut, I'm going to do a comprehensive gut analysis in order to find out exactly what's wrong with the gut. So we're going to check digestive enzymes, inflammatory markers, bile acid metabolites, short-chain fatty acids, if there's any potential pathogen overgrowth, commensal bacteria, and then what's the ratios of those bacteria to each other. And so oftentimes we may see a pattern where people have relatively okay probiotic strains, but they've got a lot of overgrowth. The amounts, their patterns, so we want Firmicutes to Bacteroidetes, there's these different phylum of bacteria. We want them to be balanced with each other. And so even if your numbers are maybe within range. The green, we're still also looking at overall their relationship and their ratio to each other. We're looking at whether or not only is there inflammation in the lining of the gut, but is there a leaky gut? So what are their zonulin levels? What's their inflammatory reaction in their gut? So secretory IgA, is that elevated or is that low? Or do they have fecal antigliadin? So sometimes people think that they're doing fine eating wheat or gluten products. They think that they're okay and they've been tested for celiac disease, or they've had their blood tested and they've been told they're not reacting to gluten. But actually, nobody's told their gut that. So they're having localized inflammation from gluten. And so we can measure that by looking, is your gut reacting directly to gluten? And we can see that in a gut health analysis. So in order to heal the lining of the gut, or heal the gut in general, we have to understand a lot of what's happening in the whole gut environment. So I see so many people that come in and tell me, I've been taking probiotics for years, and I think that's terrible. I don't want you to be taking probiotics for years. You're creating dysbiosis. Have you called down there and said, hello, who are you deficient in? What can I supplement you with today? What's going on down there? No, you have no idea. So you're just indiscriminately deciding to take a bacterial strain, which you may already be overgrown in.
That is so important. That's such an important point, because that's also, I see that parallel with how we treat the mouth. And I think that's the shift of like the functional approach, where a lot of times we're trying to just get rid of we're a disinfection approach to cleaning the gums, but there's a balance, right? We need the good guys and the bad guys. And if we're just disinfecting, we're not actually improving the health, and we're creating imbalance. So we want to kind of nurture the good. So I think that's super powerful to be able to have that knowledge of what's going on with your gut and what's going on with your saliva, because they're connected.
So kind of doing a gut health analysis and what I can do to treat the gut would be first identify what the imbalance is, if we need to put people on a remove protocol, we do. I'm not against probiotics. I do use probiotics when I know what the problem was. Repair the lining of the gut, put people on digestive enzymes. You know, it's pretty complicated, but it's addressing what we found in the testing.
Right.
And it's, you know, not a 1 month and we're all done process.
Right.
It is a bit of a process, but we work through it together and we go in stages.
Right.
So oftentimes I do a fairly thorough exam, and I will have people that have chronic sinus infections, and when I take a look at them, I'll notice inflammation in their lymph nodes in their neck. I'll notice inflammation in the gums. I'll notice inflamed sinus tissues, even sometimes inflamed parotid glands, which I think often get missed, but because I've dealt with parotiditis so frequently, it's just one of the things that I automatically check. So what would be your approach to working up or testing for just sort of inflammation all up in here?
I love your exam. That is super thorough. And I feel like sometimes this is an area that's not as familiar for medical colleagues. I love your assessment because it's very similar to what we're doing.
Yeah.
So we're palpating nodes, we're checking thyroid, and then we go intraoral. So if we're concerned about inflammation, so one of the things that we would look at would be saliva testing. Of course, if we check of the space between the tooth and the gum, we get measurements for that. We check if that makes bleeding happen, and the bleeding is a sign of inflammation. So if we have concerns about inflammation for whatever clinical sign we're seeing, we can get more information 2 ways. One is looking under a microscope to see the actual microbes, to look at motility. And then from that, we don't know exactly what those microbes are, but we know if they're present. So we can get more information specifically by sending off saliva for testing. And once we do that, we can really understand the 5 main bacteria that are contributing to the chronic diseases that we see, whether it's cardiovascular disease, pregnancy issues, musculoskeletal issues like arthritis, diabetes, all of those kinds of things. So saliva testing will tell us exactly which microbes are present. And like you said, then we can have a targeted approach where we're not just guessing. We're not just putting somebody on an antibiotic hoping it goes away. We're understanding what's present and which methods and modalities are going to be effective for what's present in your body. But the other thing that we want to look for is if you're having concerns about sinus, are latent infections. So the main way to do that is to look, first of all, at CBCT imaging. So we have 3D imaging, and that's an important distinction from what is common in a lot of dental offices. A lot of times we're looking at 2-dimensional imaging, and that's not going to give us the full picture. So we really need to have a 3-dimensional view to actually be able to rule out if there is or isn't something present. And we would need to see actual bone loss to understand if there is infection on the radiograph. Now, the other way, the earlier ways to detect that would be saliva testing and blood work. So we can look at the myeloperoxidase levels, where we could kind of
check that
collaborate.
Too?
I can check it, but if I'm working with someone like you, I'll ask you to check it.
Oh, that that's a marker for cardiovascular inflammation. It tests for what we call intraluminal inflammation. So it's just inflammation in your blood vessels.
Yeah.
I love that you know what that is and that you check that.
Well, and that's a big part of the Bale-Doning method because it's a root cause issue. So if that's elevated, but you don't see a systemic cause, we should be thinking we have to check all of the teeth in detail to see if there's something going on. Could it be dental related? And so that's super powerful because you are looking for different things than I am, but we have to treat the whole body together.
Yeah.
You know?
Oh my God, we're definitely having you. We're going to do like a series of functional podcasts together. Yeah. But just to help give people information now, which we promised them. So what are some of your tips for maintaining just overall good oral health?
Yeah, I mean, the thing that we talk about, we get passionate about, of course, systemic health, and there's real and there's ideal, right? We all want to work towards health over time. No one has to be perfect.
Right.
I certainly am not. We want to enjoy our holidays, and we live in a modern world. So the things that I like to do with me and my family are, of course, if we plan on enjoying sweets and treats, doing it with a meal is better, so that your body has natural time between meals to recover, and the saliva can buffer the pH. And like we talked about with the water sources, drinking lots of water from good quality sources and looking into the water quality in your own home, which is your primary source. Some of the toothpastes that I like to use are the Risewell products. Those are hydroxyapatite focused. And I love cocoa floss, which is floss made from coconut fibers, so it doesn't have the forever chemicals in that.
So where do you get cocoa floss?
You can get them really anywhere. Amazon sells it.
Gotta love Amazon.
And you can go direct to their website as well.
Oh.
So that's a common stocking stuffer for me, to give out cocoa floss.
Okay. Okay. And then you had a few books that you kind of wanted to talk about.
So for people who want more information, some of the books that I recommend to patients are Whole Body Dentistry. I actually get a lot of calls for patients asking me if I've read this book.
Really?
And so a lot of people really want that holistic approach to dentistry. And these are probably other more further podcast conversations that we could have with the other books.
Okay.
But yes, and making sure, the other thing that I would say, vitamin D levels are important. So checking your vitamin D levels with someone like you to make sure that those are in a healthy range can help make sure that any kind of exposure that might increase our cavity risk we're not going to be as susceptible. Yeah.
So we will plan on having a series of podcasts and having you come back, because I just think we barely touched the tip of the iceberg.
Each topic is probably its own
hour-long podcast, quite honestly. But I appreciate everybody listening to the conversation today. I really appreciate having you come over. So again, this is Dr. Shannon with Wellspring Dental, and again, when we're talking about overall body health, thinking from top to bottom and all the different systems, how they work together, and inflammation being a big part of what we're both focused on. So I always tell people, you have rheumatologists, you have neurologists, you have orthopedists. I think of myself as being like an inflammatologist, really, because the underlying root cause of most chronic disease is inflammation, including mood disorders and physical health disorders.
Absolutely.
So really learning how to live an anti-inflammatory lifestyle overall is the foundation for health.
I love that.
Yeah. And so you're a big part of that for people in ways that they probably haven't even considered.
Yeah. Thank you.
So,
appreciate you having me today.
Thank you. Take care, everybody.